On April 25, 2015, a 7.8 magnitude earthquake struck Nepal, causing massive destruction. Nearly 9,000 people lost their lives, and more than 2.6 million people were displaced. While the ground continued to shake with epic aftershocks, our priority was to make sure the children in our care were safe, then that our team was safe, then that our partners and their communities were safe, and then to reach out to the wider Nepali community. Within 2 days, Adara had mobilised a team working tirelessly to help people in affected areas. Prahlad Dakal, Adara's Nepal country director, led his team with the mantra, "We are safe, so now we must help others." Adara's first response was to provide emergency medical assistance to the thousands of sick and injured. They travelled to the most affected areas with a mobile medical camp made up of Nepali doctors, nurses, and led by Adara's health assistant, Manuka Rai. With more than 900 health facilities completely destroyed, these services were critical. Through the first 2 months alone, they provided medical care and assistance to almost 2,000 people, many of whom were children. The earthquake left thousands of children extremely vulnerable. People who have lost everything are more susceptible to the promises and lies of the child traffickers, believing they are merely sending their children to safety. Many children were trafficked following the earthquake. Because of our expertise in working with vulnerable children, Adara was called upon by the Nepali government to provide counselling and medical support to more than 240 children at this time. While our team on the ground worked hard to reach the most vulnerable, Adarians across the world were inundated with support. In just a few months, Adara's friends and supporters dug deep and raised a whopping $570,000. Thanks to the Adara businesses paying all our core support and administration costs, every cent of every dollar raised will be used on the ground in Nepal. Throughout this response, Adara was working in close collaboration with the Nepali government and other NGOs. At the request of the government, Adara focused our efforts on assisting a severely affected place called Gung, a 4-hour drive north of Kathmandu. Gung is home to 765 households. It is a very low socio-economic area with a literacy rate of just 11%. Gung was horrifically affected by the earthquake, with many families losing a loved one, and every single building being destroyed. It is also the epicenter for trafficking in Nepal, with barely any girls above the age of 10 remaining in the village. Racing to beat the monsoon rains, the Adara team provided shelter to all 765 households. 8,000 sheets of tin were provided to help people build strong temporary shelters. The tin will be reused when they rebuild their homes. Tin was also given to the 8 schools and 1 health post in the area, all of which were completely destroyed by the earthquake. With farming and agriculture crops destroyed, Adara also distributed 88,810 kilograms of rice to 2,276 households in and around Gung to ensure they all had enough to eat. Adara's medical team, including a counsellor, spent 2 days in Gung to provide medicines and psychosocial support. 1,500 bars of soap were distributed to help control illnesses, and 110 people received medical support. So what's next? Adara will continue to focus our efforts to help the people of Gung assisting the poorest and most marginalised. We will provide more tin, so they can build themselves permanent homes, ones that are built to the Nepali government's building codes. We have 17 years of developing a model school in Humla. We want to build a similar residential school in Gung to increase the literacy rate and to provide opportunities for young girls, so their parents are more inclined to keep them in school locally, rather than be persuaded into sending them away in the hope of an education elsewhere. The school will include a health post and will become a central hub for the whole community. Adara will continue to stand with the people of Nepal, working across nutrition, healthcare, shelter and education needs, as the rebuilding of this magnificent country continues.
We and our family members are safe, so now we must help others.